Lecture we will discuss the thoracolumbar fascia. We discuss this topic along with the posterior abdominal wall. So this is a very small topic but very important clinically. Now what are the functions of the thoracolumbar fascia? It is involved in movement and load transfer between trunk and the limbs. Now it houses several deep muscles of the back. For example, quadratus lumborum, transversus spinalis, spinal erector and multifidus muscle. Then it contains a number of nociceptive nerve endings that may be responsible for some forms of back pain. Now this thoracolumbar fascia is enclosing the deep muscles of the back. You can see here the thoracolumbar fascia and the three layers of it, that is anterior, middle and posterior. So this is anterior layer, this is middle layer and this is posterior layer. Now in this we can see this is the posterior layer and this is the anterior layer, and in between this is the middle layer. Now extent is the posterior layer covers the loin and is continued upward on the back of the thorax and the back. And the middle and interior layer, they are confined to the lumbar region only. Coming to the attachment, first is the posterior layer, which is attached medially to the tips of the lumbar and sacral spine, and laterally it blends with the middle layer at the lateral border of erector spinae muscle. So this is the site of attachment of erector spinae muscle. Superiorly, it continues on the back of the thorax, where it is attached to the vertebral spines and the angles of the rib. So inferiorly, posterior 1/4 of the outer lip of the iliac crest, it is attached here. Now middle layer, medially it is attached to the tip of the lumbar transverse processes and the intertransverse ligaments, and laterally it blends with the anterior layer at the lateral border of the quadratus lumborum muscle. Then superiorly it is attached to the lower border of the 12th rib and the lumbocostal ligament. So this is the extent of middle layer. Coming to the anterior layer, medially it is attached to the vertical ridge on the anterior surface of the lumbar transverse processes. Laterally it blends with the middle layer at the lateral border of the quadratus lumborum, and superiorly it forms the lateral arcuate ligament extending from the tip of the first lumbar transverse process to the 12th rib. So this is the region where anterior and middle layers, they are confined. So this in this lumbar region, and inferiorly it is attached to the inner lip of the iliac crest. So this is the attachment of the three layers of the thoracolumbar fascia. Coming to the clinical correlation of the thoracolumbar fascia, so chronic low back pain, which has been implicated in pains of the lower back region, buttocks, piriformis syndrome, and sacroiliac joint pains. Now, injury to the thoracolumbar fascia usually manifests as tightness, spasticity, and increased tone in the lower thoracic spine or lumbar spine, paraspinal region, causing severe pains. So, these are the clinical correlation of this thoracolumbar fascia. So this is very small topic but important topic. So this is all about this. Thank you very much.